The World Health Organization is recognizing hearing loss and ringing in the ears as potential rare side effects of the COVID-19 vaccines. For months now, the ABC 15 investigators have shared stories for people who got the vaccine then developed hearing issues. Now the WHO is recommending more studies and alerting healthcare professionals around the globe. Investigator Melissa Blasius is live in studio with a major update on these unheard concerns.
And Steve, they are unheard no more. The leading public health agency in the world is listening and taking action with a report in this pharmaceutical safety newsletter. This is finally the kind of recognition so many people have been hoping for.
It was louder than the car radio.
We first met Robert Edmonds in July last year when he was seeking treatment from a specialist after developing tinnitus, ringing in the ears, shortly after getting his COVID-19 vaccination.
I'm aware of thousands of people like me across the world who have been struggling to get their doctors to work with them, to try and provide treatments or study them.
Now, the World Health Organization has published a report identifying hearing loss and tinnitus following the COVID-19 shot as a preliminary signal. That means there's a possible causal relationship between the auditory problems and the vaccine.
If we want to have vaccine confidence, we have to be transparent in all that we do. If there are concerns over these issues, then the best thing to do is understand them and their relationship.
The WHO's research looked at reports from vaccine recipients in 10 countries, including people who received the Pfizer, Moderna, and AstraZeneca vaccines. More women than men reported, with the median onset time of 1 day. And they tended to be young, healthy people, according to the report. Many experienced a quick recovery, although some found relief with steroid treatment.
It's overdue. But yeah, it's helpful. And once we acknowledge it, we can start thinking about the mechanisms and possible ways to prevent and treat the disorders.
The WHO encourages more study, but debate remains. Here in the U.S., the CDC and FDA have repeatedly said they did not find tinnitus or hearing loss to be associated with COVID-19 vaccines. And while Johnson & Johnson has added tinnitus to its list of possible COVID-19 vaccine side effects, Pfizer and Moderna have not made any connection.
It feels almost like the international community is more willing to consider this possibility than the U.S. is.
Robert wonders if his hearing will ever return to normal, but he wants other people who develop tinnitus after getting vaccinated to learn from his experience and have hope.
Whether it is or isn't related, I want them to be able to go to their doctor and be able to know to get treatment as soon as possible.
And as we've said throughout this investigation, these sudden hearing issues reported after the vaccine are rare. According to the CDC, there's only about 15,000 Americans who've made official reports about tinnitus problems compared to hundreds of millions of shots administered. Health officials still strongly recommend getting the COVID-19 vaccine for most people. And if you have any questions or concerns, you should consult your medical provider.